Good evening to all the viewers who are watching live and will be watching on the recorded version. This is me, Orko Mukherjee, with you. And again, let me just tell you, we are facing many difficulty issue with the auto e-generation certificate. We are not getting through the line, but don't worry, we will just continue that soon. So without we have wasted 19 minutes. So without wasting any more time, let's just jump into 30 seconds countdown time.
Good evening, everybody. Good evening, sir.
Good evening. Very good evening to all of you.
And we are now on the 117th episode of CME, organized by National Institute of Homeopathy Alumni Association. On this 117th episode, we are proud to announce that we will be having our alumni meet, next alumni meet in 2025 in the second or third week of December. Our beloved director, sir, Dr. Pralay Sharma, had permitted. We will be soon finalizing the date depending on certain other legal paraphernalias. But all the alumnus who are watching and will be watching on the recorded version, please note the date. It will be most probably between 12th and 13th of December. So within June 2nd or 3rd week, we'll be finalizing the date. And with me, our beloved President, Dr. Devnaran Kalyani sir, with whose inspiration we had been able to continue this CME since the days of inception, from the offline, that is live CME at NIH Auditorium, then NIH Seminar Hall, then the new building, then some classrooms. From there, the COVID stage appeared, and from there on, we started during the COVID stage with online CME. And this online CME, the 117th episode. Kalyani sir, with your permission, may I call tonight's inaugurator?
Sure, please go ahead.
Thank you, sir. And we have a very dynamic doctor, proud alumnus of NIH, Dr. Tina. I request Dr. Tina to be on screen, Orko. Tina has been an inspiration to.
Good evening, everybody. Thank you.
Good evening. Very good evening.
Tina, stage is all yours.
All right. Thank you so much. Very good evening once again to everybody. This is Dr. Tina Banerjee from NIH 10th batch. Thank you so much, Kalyani sir and Dr. Bidyut. Firstly, I want to pay a deep gratitude to our core team behind this CME by NIH Alumni Association. Am I audible? I just want to confirm once.
Yes, ma'am, you are audible.
Okay, thank you. This CME, the core team behind the CME by the NIH Alumni Association, that is a respected Dr. Kalyani sir, Dr. Bidyut, Dr. Pralay Sharma sir, and Orko Mukherjee, Dr. Orko Mukherjee, for their tireless hard work and support to be consistent with such a prestigious platform full of learning, which had started in June 2020 during COVID, where I had also got a chance to be a speaker in the 9th CME. So, without the united support of this team, it wouldn't have been possible to reach so far so successfully. Thank you so much once again to this core team. I also want to welcome all our dear audience, our listeners who are always supporting us with their patient listening, as this really motivates us every time with our continued learning. Today, I am very happy to be here in such an esteemed platform as an inaugurator. And let me first introduce our today's speaker, Dr. Kankan Sengupta. He has done BHMS from 10th batch NIH. He worked as house physician in NIH and ID in BG Hospital, Government of West Bengal. Previously, he was attached to Anandolok Hospital, Renaissance Hospital, Zoom Healthcare, and Diabetics Research Center. He is now an independent practitioner since more than 20 years and runs his clinic and its different branches by the name Zenith and Zenith Health Clinic. As Dr. Kankan was my batchmate too in 10th batch NIH, I always remember him as a very helpful, studious, studious boy with a serious look and meticulous as a student who was always committed to his work, and therefore after more than 2 decades now, knowing his achievements make me feel proud. It gives me immense happiness to share that docindia.org has ranked him number 3 in top 10 diabetologists in Kolkata. He is also been ranked top 10 as best infertility specialist and specialist in sexual disorders. Konkon's forte of work is specially on lifestyle disorders, under which also falls our today's topic, dyslipidemia, homeopathic approach and management. Now, I would like to introduce our today's moderator, my guru, our beloved, respected Sir, Professor Dr. Abhijit Chatterjee. As we all know him, our as our beloved AC Sir, he has been a lecturer for 9 years in the Department of Materia Medica at Burdwan Homeopathic Medical College before joining National Institute of Homeopathy. Sir has been an HOD Materia Medica also in NIH. He became our director from 2017 to 2019. During his tenure, Sir has brought a new era in our campus by his vision. He has always been very humble and supportive for not only the students and doctors, but also the staff and administration, as he introduced the promotion scheme called the Dynamic ACP, which brought a lot of happiness and feeling of gratitude towards him. Then, NABH accreditation is very important for any healthcare setup for its quality, and this vital task was accomplished under him too. Then the inauguration of our new hospital building and the foundation for the new girls hostel was also laid under Sir. The project Narela MOU was also signed and given shape under Abhijit Sir's vision and guidance. As we all know, Sir was the HOD of Materia Medica department in NIH. We were very fortunate to have been his students for a very long time. I remember his classes used to be very interesting and full of fun. By the way, he used to teach us each and every drug picture, has made his classes very unique, and we still remember the drug pictures in our minds. Especially, Sir is back. Presently, Sir is back to Burdwan Homeopathic Medical College and Hospital as Professor of Materia Medica. I also want to mention specially here that we, the students of 10th batch NIH UG, had a wonderful time, a memorable time, as during our first year educational botanical trip to Mongpu, Darjeeling, Mirik, and Pashupati and Gantok. We were fortunate to be accompanied by Dr. Abhijit Chatterjee sir and his family, and our late beloved Gitoshri Pal ma'am. So this all together, we were so lucky, and we had a lovely time. It was so much fun and still holds a special place in our all of our hearts. So here I want to um, end my short or long speech about my today's speakers. Uh, Vidyuda Orko, if you can bring our moderator, sir. Good evening, sir.
Good evening. Am I audible?
Yes, sir, you are audible, sir.
Thank you, Tina, for a wonderful introduction regarding today's program. And thank you, Dr. Kollanida, Dr. Bidyut Mukherjee, Dr. Orko. I'm in a very bad situation right now, but I am very happy to say that it was started in my tenure. The CME program was started in my tenure, and it is still continuing, and a 117 episode is going on today. It's a wonderful thing. Now, Kankan will explain. Kankan was also my beloved student. Tina definitely. And other all the 10th batch students are very familiar to me, right, from the very beginning till yet. And some of them are still in my contact. Anyway, very nice. Now, the I will say something about the dyslipidemia because I am not in a position to speak vividly in other drugs. Anyway, uh, thing is that Dr. Kankan Sengupta has prepared, I think, very nicely, and he will explain his dyslipidemia. Uh, I just want to say that dyslipidemia usually patient appears before us sometimes asymptomatic. There is no symptom, only asymptomatic. But seeing the report, he has the fear of death. That is, doctor, my triglyceride is now 390. Cholesterol is 295. So I am going to die. Whether any time my heart attack will occur at any time. But obviously, our constitutional medicine helps. But sometimes it happens to be that it is failed to give proper action in case of constitutional medicine. There is some organopathic medicine we have to use. The first medicine I like to say that Sambul. Sambul is a medicine which is used for dyslipidemia, but if the patient may be hypertensive or patient may not have hypertension. That is, BP may be normal, may be high. In that case, the anxiety that I am going to die by heart attack, just seeing the reports, but there is no complaint as a just asymptomatic appearance before the doctor, and anxiety is there. My report is this, so I'm going to die. Here, anxiety plus fear of death with dyslipidemia is a very good symptoms of Sambul. And Sambul is a bit like a Moscas. Moscas is that also having anxiety. But Moscas is very expensive, but Sambul we can use in potency as well as in mother tincture form we can use. And another drug I like to, one more thing, that sometimes there is pain in the left chest which extends down along the left hand. And patient always think that at the time of pain in the chest, though I am going to die. Second medicine I like to say is a Crataegus. Crataegus, one of the most important medicine for our dyslipidemia. And here also the symptoms present in the left side of the heart and left side of the chest, where back means just beside the spine, upper part in the chest and back. Sometimes the patient also having pain at the time of working or vigorously exertional work, and stress factor also triggered the pain chest and dyspnea. So here also we can use Crataegus as other medicine for good drug. Other drugs are there, so many drugs are there like Guateria glumeri, like Glyceria glabra, and another more important medicine is Baraita mure. Baraita mure, we all know that it is a group of Baraita having a tendency to affect the glands, mostly the glandular enlargement. And here the salivary glands are mostly affected in the region of throat. And atherosclerosis is one of the most important symptoms for Baraita mure. Here also anxiety is present. Here also the patient used to have pain in the head, not with profound intensity, but persisting type of headache. So in here also, in case of old age patient, we can use Baraita where the patient having peculiar hypertension, that is high systolic pressure, comparatively low diastolic pressure. So this patient, dyslipidemia with such type of hypertension, and patient in old age behaves like a child. These are the combination of Baraita in uh, dyslipidemia. So I am not saying more. Dr. Kankan Sengupta will explain more and more vividly before you. You just listen him. Kankan Sengupta, please. Thank you. Thank you all.
Am I audible?
Yeah.
Am I audible? Am I audible, Prof?
Yes, sir, you're audible.
Okay, then let's start. Shubho Sandhya and everyone. Good evening to all, and who will now I would like General Secretary for giving actually Bidyut did
Sir,
as a
sorry to interrupt, sir. Hello, sir.
unavoidable.
Hello, sir. Sorry to interrupt, sir. Hello. Kankan, sir.
Hello.
Yes, sir. Sorry to interrupt. Sir, you just close the other phone because it's being echoing. Close the other phone. Close the other phone because it's echoing totally. Yes, sir. Now speak.
Now,
Hello, sir. Yes, sir. Same, sir. Same. Sir, you just turn off the other phone, sir. Sir, your second phone is on, so turn off that because both of your phones are turned on. So turn off that phone.
but the
Just turn
browser
off
has
that phone.
blocked your mic and camera.
Yes, sir.
The other phone showing the browser has blocked your mic and camera.
It has blocked. Just remove your screen from that, sir, because it's echoing. Because when you are speaking, that thing is means emitting audio, which is just helping the other phone to echo. So just close that phone. Close that phone,
Okay.
and now continue, sir. Just tell once. Now
Now
it's
is
okay,
it
sir.
clear?
Continue, sir. Now it's okay. Now you're clearly audible. Yes, sir.
Okay.
It's clear
Okay.
now.
So good evening to each and everyone. Good evening to Bidyut. Now I would like to thank Dr. Bidyut Mukherjee, who is the General Secretary of NIH Alumni Association, for giving me this platform. Actually, Bidyut is asking me for several times to participate as a speaker on this platform, but for some unavoidable circumstances, I couldn't. Thanks, Bidyut. Now I wish to thank Dr. Narayan Kalyani, uh, President of NIH Alumni Association. Thanks, sir. Let's talk about today's inaugurator, Banerjee. He happens to be my batch at NIH and a very good friend of mine, and still we are in touch. He worked in government of Haryana as medical officer, and presently he is an eminent practitioner at Hyderabad, dealing successfully with asthma, migraine, and autism spectrum disorder. Thanks, Tina. Now I want to thank Abhijit Chatterjee sir, to this moderator, former director of NIH, departmental of Materia Medica, and also my project guide during EG courses at NIH. I have learned many things from him in terms of experience. He's way ahead. Thank you, sir. And not the least, I like to thank Mukherjee, who is backstage editor and today's he is also the backbone of this program. So with kind permission from you all, now I am entering into dyslipidemia. Now, what is dyslipidemia? Dyslipidemia is the metabolic disorder characterized by abnormally high or low levels of any or all lipids. Examples are fat, triglycerides, cholesterol, and lipoprotein. Actually, dyslipidemia is a broad term, refers to an imbalance of blood lipids, which commonly includes high level of LDL cholesterol, that is low density lipoprotein, triglycerides, and low levels of high density lipoprotein, that is LDL cholesterol. In today's world, advancement of medical science, the most lethal category of disease that was nothing but communicable disease reduced markedly. Now, you can say, what about COVID-19? Okay, it is normal, like COVID-19, 2 or 3 such communicable diseases in the century, quite normal issue. But the main threat to 21st century is nothing but the lifestyle-related metabolic disorder, which include disorder of glucose metabolism, that is diabetes or hyperglycemia, and second is disorders of lipid metabolism, that is dyslipidemia. Now here, interesting issue, metabolic syndrome. What is metabolic syndrome? It is a combination of diabetes, dyslipidemia, hypertension, and obesity, where waist circumference central obesity, which is called central obesity, where this risk goes up with a waist size that is greater than 35 inches for women and greater than 40 inches for men. Now, regarding obesity, there is an important measurement tool also, which is known as body mass index. BMI. How is it calculated? The BMI is calculated by dividing an adult weight by their height in meters square. But you need not to be worried, as you can find several BMI calculators on the internet. So BMI is nothing but kg by meter square. Now, here, World Health Organization recommended BMI values are of significance. For adults, severe thinness is below 16, moderate thinness is up to 17, and mild thinness is up to 18.5. The normal range is from 18.5 to 25. The normal range of your BMI is 18.5 to 25. But overweight, if you BMI is from 25 to 30. After that, obesity is started, where first degree of obesity is from 30 to 35, second degree of obesity is from 35 to 40, and lastly, third degree of obesity is above 40, which is also called morbid obesity. It is all about BMI, and the question is the limitations of BMI. Although BMI is widely used and useful indicator of healthy body weight, it does have its limitations. BMI cannot be fully accurate because it measures excess body weight rather than excess body fat. BMI is further influenced by factors like age, sex, muscle mass, activity level. For that reason, we can see that older adults have more body fat than younger adults with the same. So here we must consider the limitations of BMI. Now come to metabolic syndrome. Today we are discussing about dyslipidemia, and we have to keep in mind that dyslipidemia alone cannot do any such harm to your body unless contributed by any of its syndrome-making bosom bodies, who are diabetes, hypertension, and obesity. So we have to consider all of them together when discussing about dyslipidemia. First of all, I want to say few words about the most popular villain of today's story, and that is nothing but cholesterol. The word cholesterol consists of chole means bile and stereos means solid, followed by clinical suffix, chemical suffix, which is OL for alcohol. In today's world, thanks to media and advertising, even a layman knows that cholesterol is the biggest culprit of all the heart diseases. But is it really true? Not in fact, cholesterol production is most important for our bodies. And our liver and intestine make about 80% of the cholesterol we need to stay healthy. Only about 20% comes from foods and we eat. Cholesterol is a natural form of natural component in everyone's blood. It builds the structure of cell membranes. It is needed to make vitamin D, hormones including testosterone, hormone including estrogen, hormones. It helps our metabolism work efficiently. Cholesterol is essential for the brain to function effectively, where almost 20% of total cholesterol of the human body is located in brain. Healthy cholesterol helps us improving memory and learning process. So cholesterol is a type of lipid or fat that helps our body perform many important functions. But still, even a vegetable oil pouch, even a packet of biscuits, so zero cholesterol tagline, which is ridiculous. Now we can think that increased level of cholesterol in our bloodstream will be much more beneficial for our health. But again, we are wrong. Anything excess might be harmful to your body. Here I want to tell an interesting story regarding villain cholesterol. I think many of us may know it, but still I am just briefing. Actually, the story of lipids in human starts many years ago in 1769, when solid cholesterol in gallstone was identified. But at that time, it was just an invention. Then in 1833, cholesterol in human blood was first reported by Dr. Felix Baudet. Since then, time passed by, but the typic cholesterol was identified first just after the Second World War, when American President Franklin D. Roosevelt died suddenly. On April 12, 1945, President Roosevelt collapsed while sitting for a portrait of Georgia, of a cerebral hemorrhage. Roosevelt, untimely passing, stunned the world, especially the American public, who are aware of the president's struggles with multiple health conditions like heart ailments, hypertension, bronchitis. This aftermath of Second World War made a strong theory of conspiracy. President Roosevelt was so much popular political figure at that time. Till now, he is often considered icon of American liberalism. So naturally, postmortem was done, and it was revealed that 63-year-old American president had lots of cholesterol in all of his arteries in the body. It was a base disguise for medical sciences. Thereafter, so many researches, so many trials were done to reveal the role of cholesterol taking various diseases. John Goffman, the father of clinical lipidology, started large population studies such as Framingham study in 1950. Until date, the story of lipids includes at least 11 Nobel Prizes, if I am not wrong. It is easily apprehensible that dyslipidemia is the most challenging condition for today's medical profession. From here, I am entering into the main topic and sharing my clinical experiences with all of you. It was almost 20 years back when I started my clinic just after completion of internship from LI. And at that time, my only capital was outdoor and indoor experiences of LI. And to be very honest, we all NITians are very much fortunate to get enriched by the guidance of eminent teachers and by the scope of treating huge number of patients at OPD. At the very beginning of my clinical practice, it was not very common to advance profile test to a patient as a routine one, unless he or she had a cardiac ailment of own or with a strong cardiac issues in his or her family. The other reason was that time lipid profile test was a costly blood test. But nowadays the scenario is totally changed, and the people are too much concerned, especially about their cardiac health. For that reason, now this is a very common practice at my clinic. The patient comes to visit me with his or her lipid reports along with other routine lab reports. There is no need to advise them. We know that the corporate sectors also include this for their employees as a routine annual health checkup. For mediclaim companies, also few mediclaim companies provide this test free of cost for their customers annually. Now the question is why I am telling about the lipid profile test, and the reason is first and foremost about dyslipidemia, that your body does not give you any sign or symptom of high or low lipid. Absolutely, there is no sign, no symptoms in our body, which will indicate us that we have dyslipidemia. In majority of the cases, dyslipidemias are diagnosed accidentally during routine health checkup. We should keep it in our mind that dyslipidemia is a silent killer. The first sign or symptom of it may be too late, when the various target organs like heart, brain, eyes, kidneys are already affected by it. And those signs and symptoms are nothing but of those organs. Like you may have chest pain, China, a most common sign when coronary arteries become narrowed due to cholesterol buildup, which may develop myocardial infarction or heart attack. Shortness of breath, which is caused by the reduction of oxygen-rich blood so due to the narrowed arteries. Pain in extremities when arteries in leg or arm are blocked by cholesterol, which is also known as peripheral artery disease, may develop even gangrene in severe cases. Now, renovascular hypertension when blood flow to kidney is reduced due to renal artery stenosis, and here BP is very high even in young people. Vascular dementia, weakness of memory, it may occur if blood vessels of brain are affected. Even ischemic stroke is common here. Another thing, age-related macular degeneration, AMD. It may occur due to dyslipidemia effects in eyes. Then heart palpitation and irregular or rapid heartbeat may link to high cholesterol affecting heart function. The main sign which is visible sometimes, that is xanthoma. These are yellowish deposits of cholesterol found under the skin, particulates on joints, sometimes we can see this sign in dyslipidemia. Although asymptomatic in majority of the cases, but these are the probable symptoms you may have with dyslipidemia, along with unexplained fatigue due to restricted blood flow and reduced oxygen to muscles and tissues. You may feel dizziness and nausea due to decreased blood flow. Now, here I am describing some risk factors or positive factors of dyslipidemia. Primarily age, cholesterol levels naturally rise with your age. It is quite normal figure of your body and we can help it. But second is gender. Men generally have higher cholesterol levels than women. However, after menopause, due to hormonal changes in body, due to lack of estrogen in body, women may suffer from dyslipidemia. Here we kept it in mind that menopausal dyslipidemia is very common and unless otherwise controlled properly, it is the main cause of heart attack in menopausal women, very early age. Now, third point is genetics. Genetics is a qualitative factor, that is family history. As a student of homeopathy, we all know the importance of family history in our clinical practice. Nowadays, modern medical scenario is with us too. The genetic predisposition can put you at a higher risk of having dyslipidemia. Familial dyslipidemia is a genetic condition where the body has difficulty removing bad cholesterol from the blood. Now, the most important point is addiction. Here I mentioned two types of addiction. The first one is tobacco smoking. Nicotine of tobacco causes your blood vessels to constrict. Smoking could induce endothelial dysfunction and the increase of circulating markers of inflammation by activation of monocytes. This can lead to increased intima media thickness of entire blood vessels and resulting atherosclerosis, which is the main indicator of cardiovascular diseases. In this way, smoking can damage blood vessels, making them more susceptible to cholesterol deposits. Now, the second one is alcohol consumption. Excessive alcohol intake can lead to higher triglyceride levels, which contribute to dyslipidemia. Here I want to share my clinical experience. It can be devastating if you drink and smoke together. This lethal pairing increases BP, damages arteries, and puts excessive strain on the heart. Both substances independently damage vital organs, but when taken together, impact is compounded. Smoking and drinking alcohol together accelerate the aging process of the body, especially of the brain. Combined users look older quicker than who are practicing a single habit. Smokers who regularly drink alcohol have more than 50% death due to this combined. So both are the combination is dangerous. Now here is another important positive factor, that is diabetes. Diabetic dyslipidemia is the most common type of dyslipidemia which I have found in my clinical practice. It is a condition in individuals. Diabetes characterized by unhealthy levels of lipid in blood, often including elevated triglycerides, low good cholesterol, and elevated VLDL, and sometimes elevated bad cholesterol, that is LDL. Diabetic dyslipidemia is often linked to insulin resistance and hyperglycemia. Hepatic overproduction of VLDL is precursors of LDL. Diabetic dyslipidemia is a major risk factor for atherosclerotic cardiovascular diseases, heart attack, cerebral stroke, peripheral artery disease. Now, my next point is poor dietic habits. A diet high in unhealthy fat, sugars, processed food is a leading cause of dyslipidemia. Consuming food high in saturated fat, trans fats, cholesterol, such as red meat, packaged food like ready-to-eat food, canned food, snacks, noodles and pasta, instant mixes, cooking paste, bakery products, beverages like cold drinks, fruit juice, full fat dairy products, they can cause dyslipidemia. Here, my advice is primarily one should restrict the consumption of 5 white poisons, which are white rice, white refined flour, maida, sugar, salt, and dairy products, especially full fat dairy products. Refined oil and all instant junk food, oily fried food should stay as well. So, what will be the correct diet for a dyslipidemia with other associated? Consume more vegetables with more fibers, green and leafy veggies, colorful veggies, lean proteins, fish oil as a supplement or from fishes directly, particularly those rich in omega-3 fatty acids. Here I should mention that various studies indicate that fish oil can significantly reduce triglyceride levels, while its effects on LDL, VLDL, and HDL cholesterol less consistent. Now, obesity, as I earlier discussed, which is another positive factor for dyslipidemia. Obesity, PCOS, that is polycystic ovarian syndrome, and type 2 diabetes are generally associated with high triglycerides and low HDL cholesterol. Lack of exercise or sedentary lifestyle is the another positive factor. Physical inactivity can lead to weight gain, which is responsible for dyslipidemia. So, as a preventive, exercise regularly, where the protocol is at least 150 minutes brisk walking in a week. That means 30 minutes per day and minimum 5 days in a week. Here, one can also see jogging, swimming, and cycling. Again, here I am sharing my experience. If I advise my dyslipidemic patient, especially above 40 to 45 years of age, for running and treadmill workout. It is crucial to approach them with caution and under medical supervision, especially if they have pre-existing heart conditions, overexertion, and sugar heart problems. Here, my alternative advice is backward walking, which we have found much more beneficial for dyslipidemic patients, where one step is equivalent to 10 steps of normal walking. Walking backward offers multiple benefits, like muscle engagement, especially for underutilized muscles in everyday movement, such as gluteus muscle, hamstrings, and traps. Improvement of balance and coordination, improvement of cognitive function, potential pain relief for lower back pain, more calorie burn, and improve walking speed and gait, and less friction in joints, and lastly, prevent boredom of exercise. These are the facilities, these are the advantages of backward walking. Now come to the part of today's topic. It is laboratory diagnosis of dyslipidemia. Dyslipidemia is the most important coronary artery disease risk factor. Proper management of dyslipidemia is crucial to control the epidemic of premature coronary artery disease in India. Cardiological Society of India tried to develop consensus guidelines for better management, for particularly for coronary artery disease prevention and treatment, and these guidelines are published in Indian Heart Journal. Here, epidemiological mapping of dyslipidemia shows higher prevalence of overall dyslipidemia, more southern and a few North Indian states, more in urban than rural areas. And whereas the prevalence of high triglycerides and low HDL cholesterol is similar throughout the country. 5 categories are recommended here. Number 1 is low risk group, general population with no risk factors. Then moderate risk group, presence of any one of the standard risk factors, which are smoking or tobacco use, hypertension, diabetes, and diabetes. premature coronary artery disease. Men less than 55 years of age and women less than 60 years of age in coronary artery disease, then it is a risk factor. Then high risk group, individual with two or more such risk factors, but there is no manifestation of atherosclerotic vascular disease, chronic disease, prolonged history of diabetes, more than 10, familial hypercholesterolemia. These are the high risk group. The other two categories are very high risk group and extremely high risk group. I am not discussing here as these two groups are already facing heart attack, strokes, or peripheral artery diseases. And genetic dyslipidemia, familial history, and high lipoprotein A is present. So I am not discussing about these two categories. Now here I am mentioning standard lipid testing panels and targets of for various risk groups according to latest protocol of Cardiological Society of India. There I want to mention that the very high risk group and extremely high risk group has been excluded here because those cases require aggressive conventional approach along with homeopathy. And on this platform, I could not discuss atorvastatin, rosuvastatin, ezetimibe, etc. They are not our target. Now I am mentioning here the desirable levels of various lipid fractions, various risk group. These all values are in milligram per deciliter, and 12 hours prior fasting is required for this lipid profile test. Here I also add that to avoid oily fried spices of food for at least 24 hours for testing. Now lipid parameter LDL. Desirable levels of LDL is less than 100, both for low risk and moderate risk group. But for high risk group, it is less than 70. Non-HDL cholesterol, that is LDL plus VLDL cholesterol, less than 130 for low risk and moderate risk group. For high risk group, it is less than 100. HDL cholesterol more than 40 for men and more than 50 for women. It is same for all risk groups. Now triglycerides less than 150 for low risk and moderate risk group, but 150 also for the high risk group also there's less than 150 triglyceride level. Here is an important inclusion of lipoprotein A, which are normally not found in lipid panels. Lipid A, if the normal range for all risk groups are same, less than 50. And VLDL, the low density lipoprotein, it is also less than 50 for all risk groups. Now here I am describing shortly about various lipid fractions. Blood lipids are fatty substances of blood which make our blood thicker, and it is not possible for blood to circulate these fatty substances to various target organs of our body directly. Here we need some transport mechanism which can transport those fats through bloodstream to the various tissues. This is a miracle of nature, that how fats transport through blood and lipid fraction like LDL, HDL cholesterol are nothing but the transport mechanism of fat in our bloodstream. And triglycerides are fats we eat, like butter, most fats we eat are in triglyceride form. Extra calories, alcohol, sugar in body turn into triglycerides, and body stores them in fat cells and uses them when required. High level of disease are caused heart attack, stroke, high level, more than 1,000 milligram per deciliter, may cause acute pancreatitis. Lastly, I want to discuss lipoprotein small a, although mentioned by Cardiological Society of India, if it is absent in maximum routine lipid profile test done in India, and very unfortunate. So if you want, you have to get it done separately, and advise I all of my patients, strong family history, to get it done at least once in a lifetime after the age of 18. Now, why it is important? Let's try to understand. Lipoprotein small a is structurally similar to LDL, but it has an extra protein portion which is apolipoprotein. Elevated LPA is an independent risk factor for heart attack, stroke, and aortic stenosis, even when LDL cholesterol is in normal level. But the interesting factor is lipoprotein small a levels are determined by genes. That means elevated levels of LPA are inherited, so they tend to remain consistent throughout life. Where diet and have no influence to change LPA levels. Till date, modern medicines, lipid lowering drugs are not effective for lipoprotein small a. So here the role of homeopathy should be considered. Excuse me. Now here I am discussing detailed recommendation of lipid profile test according to age. Children, first lipid profile test is recommended between the age of 9 and 11 years, with repeat test every 5 years. Adults, routine screening for adults aged 20 or more is recommended every 4 to 6 years, average every 5 years. Here, one point common remember that higher risk individuals like positive family history of cardiac diseases, obesity, diabetes, hypertension, or smoking and alcohol drinking may need more frequent, even yearly or even every 6 months. Aged patients, for men aged 45 to 65 and for women aged 55 to 65 should be tested every 1 to 2 years. And individuals over 55 should be tested annually. Here I want to mention a point that good cholesterol or LDL cholesterol is good or healthy if the level is for adult men 40 milligram per deciliter or higher, and for adult women 50 milligram per deciliter or higher, and for children and teens 45 milligram per deciliter or higher. But is extremely high, more than 90 milligram per deciliter, probably due to genetic mutations or too much alcohol consumption. It can speed up the process of atherosclerosis and associated cardiovascular diseases. Now, I am starting homeopathic solutions for dyslipidemia. How much time do you have left, Orko? How much time do you have left?
Sir, if you have many more, you can continue, sir. It's okay.
Okay. Now the homeopathic solutions for dyslipidemia. As I am practicing for more than 20 years, primarily in Kolkata, New Town, and adjacent areas, and today's urban population are much more concerned about their laboratory soundings than their symptoms. You have to go with these changing times as well. So here we are not discussing the constitutional basis, which always helps us to bring down the levels of bad cholesterol and triglycerides, as they are widely discussed by our stalwarts countless times in the field of homeopathy. And as practicing homeopath, we all know about those gems of homeopathy. Here I am sharing a few homeopathic organopathies which really helped me at my clinic when handling cases of dyslipidemia, which are very common nowadays, and I treat dyslipidemic patients on a regular basis. Organopathics or organ-specific medicines are often required to bring down those levels which are too high, and we need to decrease this level within a short period of time, not only for the patient satisfaction and for protecting patient's vital organs like heart, kidneys, eyes, etc. Organopathics are always helpful for us along with proper constitutional remedies. When you want to the conventional medications due to their lots of side effects and lifelong using protocol, then organopathics are very much helpful to you. These organopathics are a way forward to help you in achieving successful results. Many times when best selected constitutional medicine does not give you desired result, these organopathics will help you tremendously. I have had excellent success with this organopathic clinical practice. So without any further delay, I like to explain this 10 most used organopathic by me for this epidemic. First one is Allium ustin. Allium sativum is very popular medicine to us. It is widely used, but it belongs to the same species. But, the common name is wild garlic, Allium ustinum, where Allium sativum is our kitchen garlic. But with the more advanced properties, Allium ustinum has more advanced properties. Basically, these are the plants of mother tincture and dilutions are prepared the leaves of which contain bioactive compounds like allicin, various organosulfur compounds, and those compounds help in lowering lower density lipoprotein cholesterol levels by inhibit their synthesis and thus reduce the atherosclerotic plaque formation with the blood vessels. It can reduce the narrowing of blood vessels. It can also reduce the platelets aggregation, which is very important for cardiac patients. It has antibacterial and antifungal properties, which can help to treat various infections in our body, especially lung infections when associated with dyslipidemia. It has antioxidant properties as well, which can control free radicals in our body and thus help in detoxification of our body. It is also helpful for our digestive system, especially for liver, gallbladder, and for intestines. One keynote of Allium ustinum is burning sensation without with heat of mucous membrane for our body. It is the keynote symptom of Allium ustinum. It is very good remedy for allergic rhinitis, for joint pain, as it is anti-inflammatory, and for weight loss. Allium ustinum is the remedy takes time. I have used it in my clinical practice since recent past. Actually, we use Allium sativum for a long time in hypertension with atherosclerosis. But many times we don't have symptoms, but only atherosclerosis with same Allium group of symptoms. Here we can use it. Like Allium sativum, Allium ustinum is very close to Nagphonica. This is the remedy for meat eaters for non-vegetarians with strong constitution, firm, fresh, and dark complexion, like impatience about food, love to enjoy tasty food, gastric headache like Nagphonica, strange bowel movement, either constipated or loose motion, from irregular dietary habits like Nagphonica, chronic dyspepsia, totally suitable for high living like Nagphonica. High living means they are meat lover, they are alcohol lover, coffee lover, with prolonged history of night watching. I generally use mother tincture of Allium ustinum and at least for 2 to 3 months. Now, my second remedy is organopathic is curcuma longa or turmeric. It is my routine prescription for almost every case of dyslipidemia. Main alkaloid within it is curcumin. It has great anti-inflammatory action with its antiviral and antibacterial properties. It acts well in autoimmune diseases like rheumatoid arthritis. It has anti-aging properties as it reduces the oxidative stress of our body. It can reduce the age-related stress on our vital organs. Now, BDNF, brain-derived trophic factor, the member of the neurotrophic of growth factor. It is a protein which is involved in various brain functions like learning, like our memory, emotional processing. Reduced BDNF levels have been linked to various neurodegenerative diseases like Alzheimer's, like Parkinson's, etc. Here, curcuma longa is of great use to increase BDNF level in our body. Curcuma longa has great anti-cancer properties. The mother tincture of it has almost 30% of curcumin, which can prevent cancer as well as metastasis of cancer. If there is a history of cancer in family, if there is tendency of tumor formation in body along with dyslipidemia, use curcuma for at least 3 to 4 months as a preventive as well as curative. Here I will specify the case of the use of curcuma longa in pancreatic cancer. Now here you can use curcuma longa alone or in combination with conventional chemotherapeutic agents. Pancreatic cancer is one of the most lethal malignancies worldwide, and majority of patients are diagnosed too late. Even after curative resection, the relapse rate within 2 years more than 80%. Patients with advanced pancreatic cancer, systemic gemcitabine based chemotherapy has been standard therapy in conventional system of medicine. Here, if we use curcumin along with gemcitabine, pancreatic tumor growth suppressed more effectively than either agent alone. And here, the added benefit is reduction of side effects of conventional cytotoxic chemotherapeutic agents. Here, the safety of curcumin has been approved by WHO. In obesity-related cancers like pancreatic cancer, ovarian cancer, abnormal lipid metabolism has been identified. Here, curcuma longa is the best solution. Curcuma longa improves liver function by increasing bile secretion. When jaundice or sluggishness of liver associated with dyslipidemia, we can use curcuma longa. It has active antioxidant properties which increase the lifespan of our cells in body. It has great ulcer healing properties. Hence, it is used in gastric ulcer in gingivitis. Now, I am sharing common blood reports which are improved dramatically by using curcuma longa. First one is total leukocyte count. Areas viral or bacterial infection like throat infection, bronchitis, UTI, the total leukocyte count becomes high, and here curcuma longa can reduce total leukocyte count very effectively. It acts. Second number is inflammatory markers, that is ESR and CRP. When ESR is more than 30 or CRP is above 6, here I use curcuma longa mother tincture. I used it very frequently during COVID period when CRP is often found very high, even more than 50. And curcuma longa has given me very excellent result. Now, TROP-T, troponin T marker. It is very popular myocardial infarction marker. If blood report shows high TROP-T, it is not always that you have heart attack. You have a but maybe due to other cardiac conditions like unstable angina, like arrhythmia, like cardiac failure. But in all cases, curcuma longa can help you to bring it down. And lastly, lipid profile is very much related to today's topic. High LDL cholesterol and triglycerides are very well controlled by using curcuma longa. especially if triglyceride is very high, above 500, and there is a risk of acute pancreatitis. Curcuma longa can help you to reduce that elevated triglyceride if you use it aggressively. I usually give mother tincture for at least 3 months. For more absorption of curcumin in body, I often use Curcumalanga mother tincture along with 5.9 gram mother tincture. That is black pepper mother tincture. Now, my third remedy is Ferula sambul or mushroom. It is very important remedy as the SSR told, and it is very much important remedy. I also found in my practice it is very much helpful, especially when cardiac pain is involved. It is my main weapon to deal with dyslipidemia, along with closed arteries, irregular pulse, nervous palpitation, but normal, even low blood pressure. This is the combination for this organopathy. Sclerosed arteries, irregular pulse, nervous palpitation, and normal blood pressure. Marks is a substance with a strong smell that is used in making perfume. Banglaয় আমরা বলি কস্তুরি. It is obtained naturally from a type of Mondia. The homeopathic medicine which is derived from marks is not best, but original marks is very much expensive, and for that reason, many times what happens that mark which has an odor that resembles marks is used to adulterated marks when making perfume. So when we homeopathically study Sambul, we find that it has many similarities with Moscas. Sambul has many hysterical and nervous symptoms. It is emotional, dull in morning and clear in evening. Insomnia is aggravated by thinking of complaints. All those anxious, hypochondriac subjects with dyslipidemia are losing sleep over trivial complaints, such as borderline blood reports, and they are facing sleepless nights. Nervous palpitation is in menopausal women with climacteric flushes and easy fainting. Sambul is a beautiful remedy for menopausal dyslipidemia when associated with some ovarian pathologies and violent palpitation. When we observe cardiac, there is clot in left chest, numbness and aching in left arm, just like cactus glandicularis. There is exertional dyspnea, which is aggravated by physical exertion. Very useful for cardiac asthma. Now, as I mentioned, cactus glandicularis, there is a clock sensation in left chest with numbness and aching in left arm. But in cactus, emotional aspect of Sambul is missing. In Sambul, we found both emotional and physical component, and both can trigger palpitation in patients. Sambul helps to improve the ejection fraction of heart in echo. It can improve the motility and contractility of heart. In boric Materia Medica, we find that Sambul is a tissue remedy for closed arteries. So if symptoms permit, it acts like conventional scratching in dyslipidemia. Also acts as a blood thinner like aspirin. In my experience, it is also an excellent remedy for acute myocardial infarction. If arnica is no suitable result, here there is a choking constriction of throat, itching. Another very important symptom of Sambul is oily urine when associated with dyslipidemia, often found in diabetes and in nephrotic syndrome. Usually give mother for at least 3 months. Now the fourth medicine, fourth organopathic is the most celebrated remedy for dyslipidemia of today's time, that is G.O.I. This remedy is not found in Boric Materia Medica, Allen or Clark Dictionary. Find the mention of this remedy, Materia Medica of homeopathic remedies by Dr. O.A. Julian. Very important remedy for dyslipidemia. It has more affection on hepatobiliary plane. Goteria gomeri is the combination of lycopodium and chelidonium. When you will find the patient with high cholesterol and triglycerides with some lycopodium and some chelidonium symptoms, think of goteria. If we consider pathophysiology of dyslipidemia, here the most important factor is treatment of liver. Goteria addresses the functional factor and helps to restore our liver function. Likewise, goteria is the right side of biology. Here, there is congestion of liver, base of right lung is affected, and it has strong involvement for hepatobiliary system. Although goteria is the right-sided biology, but there is a strong aggravation when lying on the right side, just like both of lyco and chelidonium. Goteria has yellow coating on tongue, liver spots on body, and pigmentation on the face, just like chelidonium. But chelidonium is better from eating, where goteria patient gets forced from eating, especially for GI cardiac symptoms. Like lycopodium, goteria patients feel better from bale food. But unlike lycopodium, goteria patients get forced from sweet corn food. Cardiac symptoms like palpitation and gastric issues are from hot foods. So for dyslipidemia with hepatobiliary involvement, where we found most of the symptoms of lycopodium and chelidonium with same distinct differences, some distinct differences. So you can use this most celebrated goteria gomeri. Use mother tincture and which is made from the dried bark of the plant. Generally, use it for 3 months. Now, the fifth medicine is Linam ubicatissimum. Linam ubicatissimum is a neglected remedy in homeopathy, as it is rarely used by the homeopath. It is nothing but flaxseed. Flaxseed fiber is used for making a costly variety of cloth like linen. And seeds of this tree, that is flaxseed, are available in market as a superfood. It is a costly health supplement. Flaxseed can improve digestion for its high fiber content, which is easily digestible. It can improve bowel movement. It contains omega-3 alpha lipoic acid, which is very much beneficial for reduction of LDL cholesterol in our blood and HDL cholesterol in our body. Flaxseed is a natural diuretic. Hence, it can be used for hypertension and it detoxifies the kidneys. It can reduce the oxidative stress of our body, thus helpful for cancer prevention. It has anti-aging properties also. Actually, flaxseed contains potassium, phosphorus, manganese, magnesium, iron, calcium, vitamin B1, vitamin B6, more minerals. Homeopathically, it can be used for high BP, high LDL cholesterol, high triglycerides, with history of diabetes, with history of cardiac ailments and constipation. Flaxseed mother beneficial for obese patients with dyslipidemia. It can reduce the hunger with the feeling of fullness. It also acts as a preventive for breast cancer and prostate cancer due to its anti-estrogen properties. It is very useful for menopausal dyslipidemia. In menopausal dyslipidemia, where symptoms are hot flashes, mood swing, and constipation. Intense irritation is the keynote symptom of homeopathic flaxseed. Due to presence of very small quantity of hydrocyanic acid within it, this irritation is caused. Paralysis and inflammation of urinary passages are the other associated symptoms. Homeopathically, it is used to treat dyslipidemia when associated with allergy, respiratory allergy, and GI allergy. All these 3 types of allergy in one patient. There are itching and inflammation in severe form. It is contraindicated in pregnant ladies, lactating ladies, and in children, as it is generally used in mother tincture form. Adult dose should be monitored properly. I generally use mother tincture 5 to 10 drops of dose for 2 to. The next medicine, next organopathic is Crataegus oxyacantha. We all know it. It is a very popular heart tonic, not only for homeopaths, even for modern medicine, cardiology is very much by them. It is very true, and it is my personal experience. It is specially acts on myocardium, and so far we know it has no influence on the endocardium. I am not discussing elaborately about this popular drug. Hence, I am just mentioning it's a dyslipidemic part only, with more affection on the cardiac plane. In Boric Materia Medica, we found that Crataegus is very much indicated in arteriosclerosis and said to have a solvent power upon crustaceous and calcareous deposits in arteries. So it is useful for dyslipidemias. Associated symptoms are dyspnea on exertion, insomnia in aortic patients. Aortic patients means aortic murmur, aortic regurgitation, etc. Who are generally cross and irritable. Air hunger and sinuses is present. Cardiac pain in the region of heart and under the left clavicle. Echo and ECG show hypertrophy of causes are here overexertion and alcohol consumption. Here, dyslipidemias are always present with hypertension. It is the most important symptom for Crataegus. Other tincture in material doses, 30 to 40 drops daily for 3 months, very useful and totally safe. Next organopathic is Terminalia orchuna. Orchuna has been used for thousands of years in our traditional Ayurveda for cardiac ailments. Homeopathically, it is used for dyslipidemias with low blood pressure. In Crataegus, there is high blood pressure along with atherosclerosis, but in case of Orchun, there is low blood pressure with atherosclerotic changes in arteries. Terminalia orchuna is the remedy for cardiac debility. We have some complicated diseases like autoimmune diseases like rheumatoid arthritis, diseases with multi-system involvement like advanced Parkinson's disease. Patients are nervous in nature with dizziness, ringing in the air, bitter taste in mouth, and scanty urination. History of any injury is a strong indication for Terminalia orchuna, just like arnica. And here I use mother tincture in material doses 2 to 3 times daily for 2 months. Now the next medicine is Baryta muriatica or barium chloride. Very important organopathic for geriatric dyslipidemia. When dyslipidemia is found in aged person, Baryta muriatica is an excellent remedy. It has many similarities with Baryta carbonicum. Another medium which I often use as a constitutional remedy for dyslipidemia of infancy and old age. So here in Baryta, we observe patients have poor memory, immature both mentally and physically, to salivation, weakness of head, vertigo due to cerebral anemia, tinnitus aureum, and swollen parotid. Hypertension is very much prominent with vascular degeneration. Arteriosclerosis, where a high systolic BP but comparatively low diastolic BP. For an example, BP 190 by 60 is ideal for Baryta. Symptoms of transient ischemic stroke in brain, symptoms of angina and myocardial infarction in heart, arteriosclerosis of the lung with penile asthma. High uric acid level is often associated with dyslipidemia. Induration of pancreas with high triglyceride level in blood. And abdominal aneurysm. Aneurysm means dilatation of arteries with associated dyslipidemia. So Baryta is a very useful remedy which I often prescribe at my clinic for dyslipidemia. Usually I give calculation forms like 3 days or 6 days or lower dilutions like party. It can be it can bear well repetition of those character cards. Now, the next medicine is Trigonella phenum descam. It is a rare medicine, Fenubric, or Bangla bolche আমরা medicine. I am using this medicine for last 2 years. But Trigonella or Fenubric is one of the oldest traditional medicinal plants in India, belonging to the Fabaceae family, and it is cultivated in the Indian subcontinent and used in many forms such as herb like dried leaves, fresh leaves like methi saak, and spice like seeds. It has numerous nutritional values. It is rich in several phytochemicals, minerals, vitamins, and fibers. Now, here I am discussing briefly the fenugreek. Fenugreek possesses many properties like antioxidants, anti-inflammatory, especially in rheumatoid arthritis. It reduces the swelling by inhibiting the inflammation of enzymes. Then hepatoprotective property. It contains polyphenolic compounds, and this compound protect the liver from alcoholic toxicity. Anti-ulcer property. Gastric ulcer is reduced by due to presence of flavonoids and polysaccharides in fenugreek. Then anti-cancer properties. Fenugreek can inhibit the growth of colon, breast, and pancreatic cancer cells. It is neuroprotective. It has neuroprotective properties. Fenugreek may help in diseases like Parkinson's disease, Alzheimer's disease, and depression. It has anti-diabetic properties. The dextromenon of fenugreek seeds may help in excreting the sugars from the body before they are absorbed into the blood. Homeopathically, I use Trigonella mother tincture when associated with diabetes, menopause, hypertension, male sexual issues, obesity, and alcoholic liver. If a dyslipidemic patient is presenting with impotency and after sphenogram we find there is low sperm count, that shows low testosterone level, patient is obese and diabetic and alcoholic, prescribe Trigonella along with most suitable constitutional medicine. Contraindicated substances are allergic peanut and soybean like product. Who have allergies to peanut or soybean should avoid methi. And I use it in mother tincture form. Now, the last organotopic of today's discussion is Thylaras polymas. It is also a neglected remedy, and its common name is artichoke. It is a popular food item with plenty of nutritional value. Homeopathic mother tinctures are prepared from the leaves, which contain alkaloid cyanopicrin. It is not covered by Homeopathic Pharmacopoeia of India, so far I know, but covered by Homeopathic Pharmacopoeia of United States and proved by Dr. Stephenson and Dr. Julian. Frankly speaking, I use this tincture only for dyslipidemic cases where the total cholesterol is within normal limit. That is LDL plus VLDL plus HDL cholesterol, but triglycerides are very much high, even above 500, with cordial angina, and there is a fair chance of acute pancreatitis. And with this high triglycerides, associated symptoms are fatty liver, jaundice, and high blood sugar level. Generally, patient is obese with bulimia, uncontrolled appetite. Used as a mother tincture, but it has positive toxicity reports, so no self-medication should be encouraged and should be taken under proper medical supervision. Those should be monitored properly. Now, lastly, here I am sharing an interesting of dyslipidemia shortly, which I am treating now. The patient is a reputed gynecologist, 55 years of age, suffering from some male issues, erectile dysfunction and lack of orgasm. Patient is hypersensitive. This usually remains 160, 90 millimeter of mercury, even after using the combination of telmisartan and amlodipine. He is also taking rosuvastatin for his dyslipidemia. but his LDL cholesterol is 150 milligram per deciliter, and triglycerides is 210 milligram per deciliter. His echocardiography shows is fraction 50%. He is having pedal edema and dyspnea on ascending. Pulse is rapid and irregular. He is a chain smoker for at least 30 years and trying to quit. The patient had come to me probably in February 2025 for his sexual issues. My prescription was Caladium Seguinum 200 once daily, early morning in an empty stomach for 1 month, along with Propanthus hispidus mother tincture 3 times daily. On his probably in April 2025, he was much better. His dyspnea was reduced as well, pedal edema up to fair extent. His BP had come down to 140, 84 millimeter of mercury. His LDL cholesterol in lipid panel was 130 milligram per deciliter. Triglycerides was 160 milligram per deciliter. Echo was yet to be done. On his note as a doctor, his injection fraction improved markedly, but still I advise him to get it before next visit. My second prescription was Caladium 1M, 1 dose weekly, along with Propanthus motherfucker as before for 2 months. Now I am waiting for his next visit, and if conditions permit, conventional medication gradually will be withdrawn. This is the power of homeopathy, and here we treat the patient, not the diseases, and the outcome is magical. Before ending today's discussion, here I would like to say that all non-communicable lifestyle disorders we are treating in our day-to-day practice, apart from dietary advice, apart from medicinal advice, apart from de-addiction counseling, apart from exercise protocol, we should encourage our patients to make sure to reduce their stress level as much as possible, as they can, and I am pretty sure they will be benefited in it. We all know it has a big role to play when deep stress is the target. But apart from homeopathic medicine, daily practicing breathing exercises like pranayam, listening, mind reading music, and proper sleeping for minimum 7 to 8 hours per day. At a stretch could give you a stress-free life to fair extent. Now, thanks to all. Thanks for listening. Good night, everybody.
Thank you, Kankan. Fantastic presentation.
Sir.
Bidyut,
Thank you.
Right.
Sir.
That's excellent. That's excellent. We are trying to get in touch with moderator Abhijit sir, but he is in some other busy with other issue program. However, I'll request Kalyani sir to sum up the session, and we have a few Q&A session, means questions in the live stream of Facebook and in the YouTube. Also, will be highlighting them. Over to you, Kalyani sir.
many thanks, Kankan.
Thank
Brilliant
you, sir.
presentation. You have taken maximum strain to present this CME. This is one asset of our CME. And equally thanks to our inaugurator, Banerjee, for giving some good informations of our proud of NIH and nicely inaugurating the session. Professor Chatterjee is a very close friend to me. All of you know, very fantastic personality, sweet, rather one of the sweetest persons of NIH. And moreover, he was telling, you'll be astonished to know that he was the founder, director of this CME of Alumni Association. It was Dr. Abhijit Chatterjee who inspired instantly, after the moment we had a talk with Union Minister Sri Joseph Nayak on this in the seminar hall with Mukherjee, myself. After coming from the hall, we talked to Abhijit Chatterjee without knowing any details, without taking or thinking. Immediately, On the corridor, he told, start Kolkata. Very fantastic program. I am always with you. And from the next, he opened the seminar hall. He used to encourage all along. Even used to be present in the CME to encourage us. And you might have seen that many CMEs he has come as a moderator to encourage us. So anyway, we are highly thankful to Professor Director Dr. Abhijit Chattopadhyay for encouraging us all along. Moreover, founder director of this CME. Anyway, regarding this lipid profile, Kankan has given vivid discussion, brilliant presentation. Its cause, manifestation, risk factor, organopathic medicines, left nothing to be unturned. Only one thing I want to tell, that his use of rare medicines, in the sense we use rarely. It is being called that the drugs are rare drugs because we rarely use it. Kankan is making a brilliant effort to make those rare drugs as a common drug, helpful drug. Very often what you do, you have become sicky to stop conventional, your profile, conventional managemental diseases of the modern medicine, that is conventional treatment of the conventional system of medicine, we are scared of, because once the level goes high up, there are risk of life risk, heart attack, brain attack, kidney failure. Most of the brilliant or very important organs are under fine control of these lipid profiles. That's why we become scared, and we ask the patient to continue allopathy medicine, allow it take the homeopathic medicine, constitutional drug. If you find the things are coming down, then gradually, taperingly, they will withdraw. That means the cardiologist or the conventional system of medicine doctor, they will gradually withdraw by seeing the result, improvement. Your medicine will continue. This was the conventional system of medicine. But the thing is that once we are indulging to continue conventional conservative treatment of the conventional system of medicine, what is the harm if we do use our rare mother tinctures or other drugs instead of those medicines? My opinion is the drug given in the literature, that should be tested. You test it, then reject it. Without testing, simply shouting on mother tinctures, lower potency is not good. That's why it's a fantastic effort of Dr. Kankan Sengupta. Please go on to keeping the records to encourage all of us that yes, these little small, rarely used drugs are very helpful in serious conditions. One thing I can tell you, that lipid profile is definitely curable in homeopathy, because of the reason lipid profile is not a disease. It is manifestation of the disease of the liver, metabolic disorders, metabolic hazardous dysfunctions of the liver. Resultant is lipid profile high. So without seeing the range, without seeing the type of lipid profiles, if we consider it systematically, the whole body is involved. Liver himself has become sick. They should be toned up by giving anti-cholesterol drug, anti-lipid profile drugs. Rarely liver will be helpful, or liver will go to his own state to control lipid profile of his own. Then this supplementation or this assistance of rather management drugs are being continued, ignoring the liver. What we do, we take the history in details, as Dr. Kankan was telling, we bring out the constitutional drug, we give it, allow it, we think whether allopathy should be continued for some time until the level comes down to normal or below normal, or we try to give our some lower potency drugs, mother tinctures or such type of drugs, to be tested that whether those drugs can take the place of this conventional conventional management drugs or not. That will be more helpful. The thing is that during our time when we were students, lipid profile disorders, heart attacks, kidney failure, various types of serious diseases, number were much, much less. The more we are advancing, more we are becoming civilized, more we are becoming modern, we are experiencing such type of serious disease, life-threatening disease caused by high lipid profile. That's why nowadays, as in the earliest phase, blood routine examination was a must for the common survey. Nowadays, lipid profile testing, as Dr. Sengupta was telling, intermittently as per age, as he clearly told, that should be tested to see whether my liver is functioning normal or my liver lipid profiles are normal. Because once it goes high, silently it grows, silently the level increases, and silently they destroy the arteries, vessels, veins, ultimately kills the heart, kidney, brain, etc. That's why much before manifestation of the organic symptom, as a routine, we should go on testing, and to whom the test is a must. Konkan has fantastically explained sugar, blood sugar level along with family history, obesity, etc. But as a whole, we are sure, as I told frequently, that these disorders of lipid profile we usually purchase for our ignorance. We forget to live as biological person. We become highly modernized person, as Dr. Sengupta was telling, fast foods, packed foods, preserved foods, and prepared foods, not directly from the nature. A beautiful thing is that all of you might have experienced that nature has made such a situation, geological situation, geobotanical situation, that where we live, majority of the drugs, majority of the sufferings medicines are available within our reach, very close. The plants, the herbs, the shrubs, the fruits, the vegetables available in your area, in my area. Many of them are fantastic medicine for serious diseases, as Dr. Sengupta has told repeatedly. So we must be more careful to take natural foods as vegetables and fruits as much as we can, colored fruits and vegetables, to prevent the serious disease. What we are neglecting nowadays, we are indulging to go to the hotel frequently. We are indulging to collect the food from outside, taking it at home or at street. We are consuming daily, every day. So gradually, what we are doing, we are intoxicating our liver to be destroyed, to be sick. Silently, liver is becoming sick. He is becoming upset. Ultimately, this lipid profile balance level, the metabolic setup, metabolic functioning of the normal liver is being disturbed silently, and ultimately goes to fatality through lipid profile. So the first learning should be from the CME, that we must try to live on nature's more regarding food. Then only we will be able to prevent many diseases. And majority of the drugs, as it is given by mother teacher or lower course, we have seen they are prepared from the vegetables that are available within our reach. They should not be ignored. Number two, any sort of addiction, first the mind becomes sick to indulge intoxication or addictions. Ultimately, that mentality cannot be controlled if we start it. It goes on increasing day by day, and ultimately destroy the normal functioning of the liver and other organs and become seriously sick. So from the very beginning, we try to restrain our addictions. We should try to observe or follow the BMI and normal body weight everywhere. Any moment you can see how many kgs of body weight you need to be. That we should be careful, that we shouldn't be overweight or underweight to maintain our internal organs normal. So this infrequent checkup, which is called as caution or health awareness, should be widely explained, widely circulated, widely used by all the person, from the child to the old people, that normal physiological manifestation of the body structure should be maintained, addition should be restrained or controlled, or if possible can be stopped, and to depend more on nature regarding food. they will prevent many diseases and will cure many diseases. I can tell you, as Dr. Sengupta told, we have number of reports that homeopathy alone, simply by constitutional drug and lower potency palliative drug, constitution and allopathy drugs, I told you that for a short period, to continue homeopathy, allopathy at a time. Then gradually, as the level will come down, allopathy physician automatically will withdraw or reduce the doses of the medicine, and ultimately patient will be cured of. So we have seen, we are having the document. If time comes, I will show you the lipid profile not only can be reduced, can be completely cured, and patient may live completely without any medicine. Neither allopathy nor homeopathy nor Ayurveda. Patient become completely free, and this is the philosophy of homeopathy. That proper cure means health as it is done. Restore the sick to health as it is done means not only curing, not only subsiding, not only giving improvement, betterment of the patient, but patient must go to the normal health, means he will be normal in every respect. Moreover, when we treat for lipid profile specifically, we are not only treating the lipid profile by constitutional drugs or your mass-treated drug. We are treating lipid profile, we are treating liver disease, we are treating the whole persons, including their indulgence, addictions, mental weakness, body weight, everything. So by homeopathic treatment, we are treating the whole person, all the organs, all the systems, all the metabolic activities at a time. That is the only system in the world that can treat all the diseases of the body by one medicine, for a very, very minimum number of medicine. So homeopathy can treat many diseases in single way, by single process, which is rare in other system of medicine. So all of us, first we must be very aware of our rise of lipid profile. Then we'll be aware of our patient, as we have learned today, that as far as if they find anything risky, get it done infrequently to save his life. Thank you very much for coming. Those who are on screen and out of screen, those who will be seeing later on, thank you all. Good day to all of you. Thank you. Bidyut, please.
Thank you so much, sir. There are a few questions on screen. I'll request Orko, I think one question from Facebook from Dr. Ujjwal Mondol. Orko, can you share the screen? Yeah, the question from Dr. Ujjwal Mondol. Over to you, Dr. Kankan. Hypertension with dyslipidemia, lipidemia not seen usually. Usually, risk factor is less or high. Please unmute yourself. Kankan, please unmute yourself. We cannot hear you.
Am I audible?
Yes.
Yeah, you are audible now.
Hello.
Audible. You are audible. Continue. Please continue.
So the Ujjwala asked a question. Hypotension is dyslipidemia. Not seen usually. Yes, it is uncommon. This factor, yes, yes. Here, I think this factor is less because if dyslipidemia with hypertension, then atherosclerotic changes are severe. Hypotension with dyslipidemia is condition, and for that condition we have some options in homeopathy, but definitely this factor is less.
Okay, thank you. I don't think we have any further questions. The viewers, if you have any questions, you get in touch with Dr. Kankan through this YouTube chat, because this video will be uploaded in the YouTube and will be there for years thereafter. And with this, with permission of our beloved Kalyani sir, uh, Orko, do we have Tina madam in the studio? Can you bring her on screen? Orko, do we have Tina ma'am in the studio? Orko, can you hear us? Orko, I think there is no. Orko, can you hear us? Facing network challenges, I presume. Tina, are you there? Yeah, Tina is there. Yeah, Orko is trying to connect Tina. Yeah.
She is there. Thank you.
Tina, any thing to add or your experience share?
Actually, I was very keenly listening to my batchmate, now a very famous physician, and he has said many beautiful points that I have noted down also. He has actually, as Kalyani sir has told about everything, very beautiful drugs he has mentioned about goteria and flax seeds and fenugreek. I am definitely going to also advise to my patients. It was a wonderful time here, Dada. Bidyut, Kalyani sir, thank you so much. And Dr. Konkon, it was wonderful. I'm so happy to be here once again. Thank you so much.
Thanks
So,
for all
Tina,
of
thank you. One more thing I want to add for all of you, brothers and sisters, whatever we listen to the CME, it is their experience, means it is their experiment. So let it be tested again. Experiment, verification. Let it be verified by all of us. Then it will be confirmed. That will be confirmation. Then we'll be able to come, yes, few of us have used it and got fantastic result. That will
Yes.
increase our strength. So
Yes, sir.
experiment, observation, verification, and confirmation. Please, let us try. Thank you, Vidyut. Please.
Thank you so much, sir. And that's a great team. With
Thank you,
this,
Tina.
we
Thank
are
you so
returning to the backstage editor, Dr. Orko Mukherjee.
Okay, good night to all of you.
Good night.
Good
Good
night.
night.
Good night. Good night. Good night, everyone.
Orko, there has been some audio challenges. Orko, are you there?
As I let Orko to come, by this time, what immediately in my mind it came that see, proper proving of homeopathy has become very rare in the world now. So all of us have to depend now on clinical proving, more on clinical proving, which isn't available to all of us. Because normal proving personnels are not available freely and it needs organization. They are doing their responsibilities like CCRH and others. We can very well experiment in our chambers, clinics, and hospitals as clinical provers. So please continue.
Thank you, sir.
Yes, sir. We all will do that. And as Tina said, that she will also try on her patients. Orko,
You are
are you getting connectivity? Orko, over to
facing
you.
some constraint. Yes, yes, taken.
Thank you all. Thanks for watching. If you have enjoyed today's series, do give it a like, share, and subscribe. And for further comments or anything you want to ask, just comment down below and subscribe for more updates. And also press the bell icon and click on all notification buttons so as to get the update fast. And also there is another option in the description box. You will see WhatsApp channel. You can join over there, and over there we just give the updates on that channel too before this YouTube. So again, thanks for watching and see you on our next series. Until then, it's me, Mukherjee, leaving.
This channel does not promote or encourage any illegal activities. All contents provided by this channel is meant for educational purpose only.